Hello everybody. I would also like to thank you for taking the time to listen to these videos, to hear the real story on the ground, the actual truth and facts of how this industry is running in the UK. But let me get some details. Let me give you the parameters, who these people are, what their actual roles are, because most people aren't aware. And as I say, it's people. What these agencies are selling are actually people. They're selling you a person's services. But they are signing up to clients. Clients sign up with an agency for a carer, but they're not told. A lot of people are unaware of what their actual role is, because a client is not going online to see what the Care Standards Act says and what the carer's role is, or what the carer isn't allowed to do. They haven't done the training or the care certificate, and a lot of this is not conveyed to the actual person receiving the care. And as I say, according to some of these companies are very unscrupulous. They are obviously just they're in there for the money. That's purely, they're looking for a gap. So they are marketing these people as cleaners, as anything, pretty much to try and get business or undercut each other. It's become a cutthroat industry of selling people, really. And anyone actually doing anything are the actual people. So let me give you an idea, because this is it's a lot of confusion. A lot of people look down on these people and not really aware of who they are, what their training is, what they're capable of, and what they're allowed to do. They are an extreme asset and a need in any country, especially in the West with our aging population. Huge amount of people needing care, the elderly, and as I say, with our wonderful Western diets and medicine, we're getting more and more people with illnesses, with autism, with all kinds of problems. So the need for care is only going to increase. What these people are, I've met the most fantastic, absolutely amazing people. It's a luxury. We should be very privileged if we are able to have someone take care of us in our own home. They provide a vital service out there. You've got, to give you an idea, so most people obviously aren't aware of this. You don't see the bigger picture. You've got all kinds of people needing care. You've got often couples, and this is why I say it's such a vital service. You don't want to split up couples. People don't want to leave their partner or their wife or their husband and go to an old age home. They want to be together as long as possible. You have people married for 50 years. So naturally, when the wife develops Alzheimer's or Parkinson's or MS or whatever the story is, they want to be at home where possible. A lot of people want to terminally ill or cancer, want to die at home. They want to, it's their choice. They have a choice to be cared for or die at home or receive care at home. Some are, say, paralyzed and have lives. So that person is an asset. That person allows them to live independently as much as possible. Some of them they're very busy people. They have very busy social lives. They go out. The carer then accompanies them to work, to opera, to college, to whatever the event is. That person's allowing that person to have as normal life as possible and to be in the comfort of their own homes or surroundings or with family or with husbands. And so this is a vital and a very privileged role if you're able to have somebody to take care of you. They're basically one step away from nurses. This is what you have, and they're treated with absolute disregard and disrespect a lot of times. Not all of them, obviously. They're dealing with people. So it depends on the family. But as I say, there's a lack of communication, there's a lack of understanding of what a carer can or cannot do. Thank you. Not also to do with a lot of unscrupulous players and agencies, not making the people aware of what your carer legally, according to training and law and insurances, can or cannot do. They're basically, as I say, one step below nurses. Some are, a lot of them are. You have ex-nurses, you have ex-therapists, you have all kinds of people working in the industry. But as a carer, they're not allowed to perform certain tasks. So podiatrist, cutting someone's fingernails and toenails for some reason, not allowed. Some, I suppose it's for safety reasons, because some would be as safe to do it, depending on the age, and some is not safe. So it's not allowed. They're not allowed to drag lift people, pull them up physically. They're not allowed to prevent someone falling, as I would say. Say your client is now falling. You're not allowed to grab them and and stop them from falling, because you can dislocate their collarbone or ankle or wrist or do more injury, more harm. So they're not allowed to actually stop somebody if they're going to fall. They're not allowed to change bandages. These are just the laws we fall under. Certain wound care, they're not allowed to change bandages and certain things, preventative as far as bed sores go, prevention. They're not supposed to be treating them, doing bandages, administrating injections. They're not allowed to do that. Basically giving the person medicine, injections, and they're not allowed to do that. They're not allowed to do an enormous amount of things, which still has to be done by a district nurse or by a doctor for legal parameters. A lot of these people are told, a lot of clients are not well aware of this. They're not allowed to use certain safety things and equipment they're supposed to have in place, which they're supposed to use instead of, physically doing it themselves. There's a lot of things people aren't aware of. You get angry with the carer when the carer says they're not doing that, or they're not allowed to do that, or they won't do that. There's a misunderstanding. But they are an incredible bunch of people. It takes somebody, quite a unique person, to do that kind of job, and a very emotionally draining, taxing job as well, because you'll have carers providing palliative care, end-of-life care. So it's for anybody, even nurses, when you're working in wards where you've got terminally ill people and you're forever losing patients, you get attached to that person to a certain extent. You're with them every day. You witness their pain, their suffering, and they die on you. It's very, very difficult. So they face difficult jobs. A lot of times people, obviously, you have with an illness or a disease or whatever the situation is, even it's Alzheimer's, you have a lot of anger, frustration, confusion about your illness. So that person is, unfortunately, not willingly sometimes, venting it. You're dealing with people that have a lot of anger, depression, anxiety, frustration, and that carer is on the receiving end of that, or around the person who's abusive, aggressive, angry, frustrated, will often vent that or take it out on the care worker. So they have to tolerate a lot of things, a lot of abuse, sometimes physical abuse, as I say, because in the condition they will lash out, outbursts, angry outbursts, a lot of reasons. There's a lot of things, but those people are absolutely an asset. They provide such a vital service. We have people, a lot of people have lost a partner. The husband might have passed from Alzheimer's themselves or died a few years earlier. And as you say, they become more elderly, frail. They're not able now to cook, to do their own food safely. The physical constraints because of lifting a kettle, cooking pots, the weakness of doing this. They don't have the physical strength to do a lot of things. So they need someone there to assist them now. They need someone to be able to cook their meals or get the shopping for them, help them bath, help them get upstairs, or whatever the situation is. They allow you to live as normal life as possible and as comfortable as possible. They're able to keep people together. They're able to, you have all various, as you say, as you would know, by illnesses, by diseases, by problems. They provide that. They provide companionship. It's extremely lonely as a person gets less mobile and older. Now they're not able to attend their social events, see their friends as much because they can't get out, or they're not able to drive anymore. So they don't go to the ladies' lunches and teas. They're not able to see their friends as much. They become more and more isolated. It's very lonely. It's very difficult. Frustrating for them as well, because now, of course, their life is extremely confined to their own home. So that person provides a vital link and companionship. So I say it's very unfair when they get told it's downtime. You don't want a person purposely, depending on the circumstances, some of them can't do it, obviously. And remember, they're completely responsible for that person's circumstances, life. So if they are now sent, like some of them are used as slaves and housekeepers and go do my garden, wash my car, who knows, all kinds of things, and the person falls. Why weren't you there? Why did they fall? Why weren't you? There's an investigation into it. The carer is always blamed. or be blamed, or first person, they will look at if anything goes wrong with the patient. If the patient got ill, the patient now dies. There's a big investigation into it, obviously. And normally the carer is always assumed responsible. So as I say, you've got to trust these people. And the sad thing is, as I say, the way they're being treated, the way they're being exploited by a lot of these companies, that they are used as basically slaves and housekeepers, and they're paid less. They pay less an hour than an actual housekeeper. So you see adverts all the time for housekeepers, which is £10 an hour, depending on £9 an hour, whatever it is. These carers are paid less than an actual housekeeper. And I know that's something that the National Carers Association is looking for, to make people aware so they get more recognition. They're not recognized for the incredible vital role they play. We have men, women, all kinds of people out there doing this, and they are the most incredible people. You are privileged and lucky if you have some of these people taking care of you. If you've ever had to do it, I think you'd understand, or even as a family member that's actually had to care for a loved one that's now terminally ill, and how busy it is, how difficult it is now to try and look after them, be with them when they need you, the medicine, pain, company, wash, bath, and still trying to run a household and cook and clean. In some jobs and instances it's not possible at all for them to do it, but they are not there as a housekeeper. They are there to provide the basics. They are there to obviously help assist the person, possibly making meals, depending on what the person can and can't do. So they're not there to take over, and they're there to encourage you to be independent, to do as much as possible. So yes, that's a vital role they play. And to think that these people are earning less than cleaners and have far more responsibility and qualifications and training than a cleaner has is atrocious. Absolutely marvelous people. So that's something, as I say, we need to look at. We definitely need to get the government to do away with this. Anybody that has any half of common sense or looks into this now, because now I've made it public, go onto the Care Standards Act and look up the requirements of personal-centered care. Now this is what they have to work under. You have to provide person-centered care, which means you do not dictate to the person their life, anything. You have to work around that person. So whatever their daily routine is, their hours, their life, whatever they're busy in their life, you have to accommodate and work around that. So it's which requires you, as you say, that's why all of them, any employed carer, or even if they're self-employed, has to work under those parameters. So they might be 24 hours in the person's house. No one is requesting 24 hours pay, because, as I say, for the times that you are sleeping, you are not working. They're not requesting to be paid for when they're not working. They're requesting to be paid for all the hours they work, to be recognized for what they are and the role they play, to be paid for all the hours they work, to be paid when they are on so-called called on duty, when you were knocked off and they are, which is often the case, woken up and have to assist the person, whether it's a toilet, whatever the situation is, help them out, put them back to bed, go back to sleep, waken up again. So that is work. You are required to work. So they're requesting to be paid for their night calls or wake-up calls, what we call them, when they are not able to take a break because of the job, the demand, the hours, the person's day might have been too busy, whatever the circumstances are, when they do not get a proper break. That means not on call, not working, downtime, completely free to do your thing, 2 hours. They don't get paid for that. But they're requesting to be paid for breaks they don't take. So these are things we seriously have to look at. We are losing wonderful people in the care sector, and we're driving them out of the care sector, and we're losing people because they are horrified when they not everybody gets bad jobs. There's a lot of, there's all kinds of agencies and sizes out there. So you're going to find some staff with some agencies that are happy. Why? Because they were lucky to get a good client and a good placement where the client respects the carer. The client is possibly not, as I say, keeping them up 15 hours a day, and not waking them up 10 times a night. And so they are working a decent hours. So there's no problem. They're able to work in that environment and function, and they're happy. They're happy with their clients. They're happy with their work situation. But there's a huge amount of carers that aren't. We have, unfortunately, because of the competition to get business out there, agencies competing with each other, they often don't tell the client. They'll allow the client to abuse, to disrespect, to take advantage of these people and not intervene. They do not go and tell the client, listen, these are the parameters. This is what your carer cannot do. Your carer has to have amount of so much sleep for your safety, for their safety, legally and humanely, and their human rights. The carer needs to get time off. The carer has to have a break. The carer has to get so much sleep. They do not intervene in this. They will allow the carer to be abused and stay in a situation. If there's a violent situation or problem as well, and the carer now decides, obviously they want to leave. Some of them just, whether they're going to lose their money or not be paid, they do leave. Because they just can't do it, or they want to be out of that horrible environment. They will shove somebody else in there. So we need to look at legislations and laws that we need a set standard. There is nothing at the industry at the moment that is a set standard. Everybody operates under their own training. There's, for instance, induction training. There's obviously a minimum basic that they're supposed to do, which I'm sure the ones that are registered Care Quality Commission will check. Whether how good the training was or not, I don't know. But it's flown through, signed off, here we are, sign, say you did this, off you go. But as I say, depending on the poor carer, the new carers, they wouldn't know which company. You go online, it doesn't tell you on their website. So when you're looking for a carer or carers looking for a placement, that we provide 5 days training, 10 days training, 2 days training. It's not there. So it depends. A carer wouldn't know. So some agencies will provide a lot more training. They do a lot more on dementia, hoisting, physical, first aid, and some do the very minimum, all that they have to legally, or at the moment, under sort of regulations or guidance of Care Quality Commission, do. So we need a set, and this is agreed by the carers definitely. We would like to see, please, in this industry, in the live-in care sector, which is not domiciliary care, it's a totally different sector, a set training, this induction training that allows them to start work immediately before they've done their care certificate. That induction training needs to be standardized completely throughout the industry to stop some of these not so good operators out there, and to provide a level so all your carers are on the same level of training. Definitely more needs to be done on personal, one-on-one dementia training, not on videos, one-on-one training. There's a wonderful lady, there's a fantastic, one of the best people on dementia and Alzheimer's in America. Her name is Tika Snow. She provides, she's been to the UK, wonderful conferences, and she trains people, an expert on dementia and Alzheimer's. And I've shared a lot of those with the people and with the carers, because there are normal, if you go and watch them, please, you can do that. Any person actually can get a care certificate online. The same way the agencies use. The agencies use certain companies that provide online training, as I say, because the people do their certificate often on the job. So they log in and you do it online. There's social TV, is one of them. I think it's Care TV, social TV, but they're the same videos. It's exactly the same videos, just maybe different company. You can do it yourself. A lot of people do that, pay for it themselves. Not very expensive, which is what you want. You want to, obviously, you don't need a shortage of carers. You want these people, especially when we've got a huge amount of unemployment, people in their 50s and over, you want to be able to get them back into the workplace, off unemployment. So if someone's unemployed, as we know, our universal credit things do not offer training. We do not pay people to be retrained up to be able to get a decent job, to be able to not survive on the state and not need subsidies to boost their income because they're not earning enough money. So we either have to look at free training, which would be a fantastic idea, or we could look at keeping it affordable and accessible. So people that want to become carers or that are unemployed are able to get this training and get out into work. So this training is online, and they provide 15 so modules to get your care certificate. Particularly, I can't say they're pleasant. Go through it yourself, do it as an exercise. Try one online, the most mundane, boring, very tedious videos to go through the way they're made out. Covers basically the legal, what you're not allowed to do. So that's the main use of them. But as far as interacting with, teaching, which Deepest Snow does, and we're really lacking it here, is teaching people. They might learn in their training, yes, what Alzheimer's does. So you understand your person's vision is affected, all these kind of things. They explain the physical, the symptoms, basically, of dementia. But how to cope with it, that's not taught. And that's, a lot of these videos are available online on YouTube, not many of them, but that is fantastic. That's something we need to make sure is included in our induction training. A lot more on people, how to de-escalate, how to approach, how to calm them, how to do all of these things needs to be done in our training. So number one, please, for our government legislation bodies, we definitely need to standardize training. Every agency, or doesn't matter if it's done through the council or online, it needs to be a set training for everybody. One thing we need to do away with set payments. We are paying people set wages for a job, which in every single job and every single contract, unless they are now, which is more popular, trying to go this, most of it's bogus self-employed. Accordingly, if you go to court, look up the parameters of what a self-employed person is legally defined as, they're bogus self-employed. Way of getting around the, and making more profit, basically. So we need to do away with this set wages, because it contradicts. You're giving someone, by law, they have to work under the Care Standards Act and person-centered care. What does that require? To do as and when the person wants it. Now, you're placed in their house 24/7 as a carer. That's exactly what you will do. You will work the hours that person is awake, whatever the requirements are for the day, what they want to do, their life. You work around them. You have to sign. It's unmanned hours or unmanaged or 0-hour variable hours. You sign away your right, naturally, because they know. Every sector and every industry knows. There's no ways. You can't send someone to their house and say, well, I'm only working a 40-hour week or 8. Because what happens the rest of the day? So basically, I'll be getting up at 7 and finishing at 5. The rest of the day, the care is your problem. So we're forcing them into this, and then we're not paying them for it. We're not paying them for, unbelievable. So that is it. Those are two things we legally, firstly morally, I'm actually amazed that we allow this. Unless it's made into law, it will not happen, because we have our so-called guidance. This is going on, and we have our regulations out there. We have this on, as far as the Care Quality Commission, or all the agencies will tell you, no, a carer is meant to have 11 hours uninterrupted sleep and 2-hour break between shifts in so-called this 24-hour cycle. They know, but then they tell them this. They show them this, lone working as well. Then they get them to sign this. Plus the person has to work. So if the carer doesn't abide by the person-centered care, or tell the person, sorry, I'm only working so many hours, they are breaking the law. They'll be fired. They'll be taken up for ill use or abuse, or not person-centered care, not treating the person correctly, because you're denying them care. You're dictating to them what they can, when they can sleep, what they can do. We can't do that. So this absolute exploitation needs to be get rid of. We have to, by law, ban the fact anyone with under variable hours, 0 hours, whatever required to work, has to be paid on an hourly basis. And I know there's a lot of push from obviously the industry to increase, because as I say, 0 hours, these people are not packers or cleaners, or they provide a very vital, responsible, seriously responsible, and basically a medical job. The carer is with that person 24/7. Their life is pretty much in their hands. So you are having a hell of a responsibility. You expect that person to make sure that your parent is not going to die, is not going to... They really have to be very switched on, and they have a lot of responsibility, a huge responsibility actually. So the fact that we're paying them minimum wage is shocking when we don't pay our nurses. So I know there's a push to get them to be, paying £10 an hour or something, because recognition, because we are. There's definitely, to register is fine. There's a push as well to register all the carers. Wonderful. But if we don't change all those things, the same nonsense is going to go on. So it's fine. We could have on the council's website, or let's say linked website, where all these carers that say have done their training. So when they finish their care certificate, are registered. I'll go into that in a second video. I looked at all that to think how to get around all this. This is the excuse from the agencies trying to manipulate that. Oh, we're going to be careful of these so-called people hiring. It's to block people going self-employed, basically. It's because, oh, well, someone can go out and work for someone and they're not actually qualified, or they can say, yes, if you've got someone naive, it will happen in the public that now looks for a carer. We're going to hire a friend of a friend to come and care for their family member. Some of them obviously for free, but generally say pay them, and that they haven't got a DBS, or they're working illegally, basically. You'll get illegal things that'll go on. It's one of those things. But that is not a problem that's not where the problems of the industry. The problem at the moment is the actual industry, is our actual people, as I would say, out there, where, as I explained, whether they're one-man bands, small agencies, induction agencies are the problem. We don't have anything set, any set standards or behavior or form of anything out there. They're all operating how they want. Self-employed people, employed people, they're all told on their contracts, the clients will, your carer will walk dogs, do this, clean the house. Some all depending on their contract. That's why I say it's variable. They're not explaining to the clients. They're not getting rid of people. Some clients they should not take on. They are not safe, or they are abusive, and they do not. They keep them. They want the money instead of saying to the people sorry, and standing and there's no protection. There's no. As a hospital worker, as we know, or nurse, when this abuse happens. Obviously, you can't physically abuse them, but they will not take abuse to staff, to speak to them and badly, verbally abuse them or physically abuse them. It's against, that's it, the person's now thrown out or removed from the surgery. As these people are alone working in someone's house, no one's witnessing this. So the carer will complain, but the agency will turn a blind eye. Doesn't matter what the person's doing, and the person walks out there, will take some unexpected new carer they've probably recruited from whoever, especially these new girls they're always bringing in, they get caught. We'll throw them in there, and the same thing will happen. So there has to be guidance and standards and protection from this, for everybody's sake. We have the most wonderfully happy carers and clients out there that love their clients, and the clients absolutely adore their carers. But we've got this situation now where we're ruining it because we do not have protection and guidance and standards. And it needs to be regulated. It needs to be legally regulated now, because we are relying on people to behave correctly. And over the last how many years now, this is not working. Far from it, actually. It hasn't happened. So without actual laws in place and set legislation, which no one seems to know what to do about the sector, because there isn't any. It's just carrying on, and it's becoming a problem, and we're having bad players, bad carers, they're recruiting people they shouldn't, all kinds of things going on out there. Anyway, that's enough for this video, and I thank you for taking the time to listen to me, and I'm talking from experience as well, out of personal experience, to see what it was like. I went and did it myself for 6 months, which I will go into telling. I went and did care work, became a live-in carer for 6 months, to see really what was going on the ground, and I will explain all that. But yes, I'm going to share a video. A lovely lady, a carer, she's been a carer for many years, very experienced carer, working for a wonderful family, ex-MP, ex-parliamentary MP, son's a barrister, wonderful people, very good woman, well trained, well experienced, and she made a video. We're trying to educate the carers out there, because obviously most of them are foreigners, and be exploited. Nobody knows, because it's, as I say, one agency does this, one does that. Nobody knows what's going on. She made a video trying to highlight what's actually the role supposed to be. As I said, a lot of these people have been sold off as basically domestic workers. And I'm going to share that on here for you. Gives you an idea. Thank you, people. Thank you for your time.